Basic human rights. That is what local lawmakers call the basis for a town hall meeting Wednesday night. Democrats and voters lay out the potential impact of the big, beautiful bill on our medical care. Politicians on one side of the aisle tell me the bill comes with a big price tag, but those on the other say it creates an opportunity to fix past mistakes.
We call it the big, bad, ugly bill.
We recognize the issue.
The big, beautiful bill, a big, beautiful problem for some.
This is a major rollback of people accessing health care, the most we've seen probably ever in the history of this country.
And a big, beautiful opportunity for others.
President Trump has just been in office for a few hundred days. It's going to take a little while to get this addressed.
A 2024 survey from Public Policy Polling shows nearly 70% of voters believe Illinois legislators haven't done enough to lower health care costs.
The concern here is at the federal level. These are federal cuts that Congress have implemented to kick off over 300,000 people from accessing Medicaid.
In the state legislature, we can and must do more.
But Senator Andrew Chesney believes these high prices began with the introduction of Obamacare.
You could start by removing all of the illegal immigrants that are costing the taxpayers over $1 billion a year from our healthcare rolls, which would certainly eliminate or alleviate some of our budget problems.
In fact, 77% of survey respondents reported concerns with their ability to afford their prescription medication in Illinois alone.
Most people on Medicaid are children, seniors, or those with disabilities. So when you cut Medicaid by trillions of dollars, those are the people who are going to be the most impacted.
The poll also showed an alarming number of people admit to rationing their medications because of high prices.
People will die. Communities will be harmed. So we have to make sure that we're fighting back, not because we're activists, but because we know that healthcare is a human right.
But is relief in sight? Chesney says yes, just give it time.
I know President Trump on the national level and his commitment to lowering prescription drug costs and creating more competition, making sure that at a minimum we can purchase at the same prescription drug costs as we do in Canada and other neighboring countries.
This town hall meeting introduced the possibility of a prescription drug affordability board, which would have the authority to evaluate high-cost drugs and set upper payment limits on what Illinoisans will pay.